Hello. We're going to be talking about pre-screening for colon and rectal cancer. Pre-screening is very important because if you find out about the cancer early on, you have an opportunity to treat it and possibly cure it. So let's learn about pre-screening for colon and rectal cancer. Now, the American Cancer Society recommends that people at average risk of colorectal cancer start regular screening at age 45. People who are in good health and with a life expectancy of more than 10 years should continue regular colorectal cancer screening through the age of 75. For people ages 76 through 85, the decision to be screened should be based on a person's preferences, life expectancy, overall health, and prior screening history. People over 85 should no longer get colorectal cancer screening. Screening can be done either with a sensitive test that looks for signs of cancer in a person's stool, that's a stool-based test, or with an exam that looks at the colon and rectum, that's a visual exam like colonoscopy. These options are listed below in a little further here. A colonoscopy is the most reliable way to prevent and detect colon cancer. Polyps are found in at least 25% of men and women over the age of 50 through colonoscopies. As most colon cancer begins as precancerous polyps, detecting and removing these polyps are key to preventing cancer. Stool-based tests. These tests look at the stool, feces, for possible signs of colorectal cancer or polyps. Many people find these tests easier to have than tests like colonoscopy, and they are typically done at home. But these tests need to be done more often, and if the result from one of these stool tests is positive, that is abnormal, you'll still need a colonoscopy to see if you have cancer. So there are fecal immunochemical tests, that's called FIT or IFOBT, every year. High sensitivity GUIAC based fecal occult blood test, HSG-FOBT, every year. Multi-target stool DNA, MT-SDNA, every 3 years. And then there's visual structural exams. Those tests look at the structure of the inside of the colon and rectum for any abnormal areas that might be cancer or polyps. And the tests can be done less often than stool-based tests, but they require more preparation ahead of time and can have some risks not seen with stool-based tests. The colonoscopy should be performed about every 10 years. A CT colonoscopy, that's with the virtual colonoscopy, every 5 years. And a flexible sigmoidoscopy every 5 years. Thank you very much. We just learned about early screening for colon and rectal cancer, and it's important to get early screening. It's so important to get screening so that you can determine whether or not you have cancer. And if you do, if you get that early notice through early screening, then it's easier to deal with and possibly cure. Thank you. Hello, we're going to be talking about early screening for oral cancer. Now, many precancers, it's very important for pre-screening because if you know about the cancer early, it's possible to treat it and possibly cure it. So oral cancer, many precancers and cancers of the oral cavity and oral pharynx can be found early during routine screening exams by a dentist, doctor, dental hygienist, or by self-exam. The American Cancer Society also recommends that doctors examine the mouth and throat as part of a routine cancer-related checkup. Some dentists and doctors recommend that you look at your mouth in a mirror every month to check for any changes like white patches, sores, or lumps. This is very important if you use or have used tobacco and or if you routinely drink alcohol, as these put you at a much higher risk for these cancers. As noted above, the HPV vaccine was developed to prevent cervical and other cancers, but it's also important in the prevention of oral cancer. Oral HPV can be transmitted to the mouth by oral sex or possibly in other ways. Many people are exposed to oral HPV in their life, but most people clear HPV within 1 or 2 years. If the infection persists, it can infect the mouth and throat, causing cancers of the throat, tongue, and tonsils. Vaccination is not recommended for everyone older than 26 years. However, some adults aged 27 through 45 years who are not already vaccinated may decide to get the HPV vaccine after speaking with their doctor about risks and benefits. HPV vaccination in this age range provides less benefit as more people have already been exposed to HPV. So early screening for oral cancer is very important because you can get a handle on it and deal with it early and possibly cure it. We're going to talk about early screening for prostate cancer. This is very important because the earlier you know about cancer, the easier it is to treat and possibly cure it. So let's take a look at early screening for prostate cancer. The American Cancer Society recommends that men have a chance to make an informed decision with their healthcare provider about whether to be screened for prostate cancer. The decision should be made after getting information about the uncertainties, risks, and potential benefits of prostate cancer screening. Men should not be screened unless they have received this information. The discussion about screening should take place at age 50 for men who are an average risk of prostate cancer and are expected to live at least 10 more years. Age 45 for men at high risk of developing prostate cancer. This includes African Americans and men who have had first-degree relative, father, brother, or son, diagnosed with prostate cancer at an early age, which would be younger than 65. Age 40 for men at even higher risk. Those are with more than one first-degree relative who had prostate cancer at an early age. When prostate screening is chosen, two of the best options are the digital rectal examination, DRE, and prostate-specific antigen, PSA test. Again, the decision should be based on a discussion with your healthcare provider. So, early screening for prostate cancer is very important. If you find out that there's cancer there, there's a better chance and it's easier to deal with and perhaps cure. Let's talk about early cancer screening for lung cancer. Now, lung cancer is one of the most preventable cancers. The best prevention? Quit smoking. Screening for lung cancer can also reduce your risk. The U.S. Preventive Services Task Force, the government body that evaluates cancer screening tools, recommends lung cancer screening for people aged 50 to 80 who have smoked an average of a pack a day for 20 years. The screening process includes a low-dose CT scan. CT scanning, also called computed or computerized tomography, is an X-ray test with the views taken from a series of different angles and arranged by a computer to show a cross-sectional view of organs in the body. Following the screening test, your healthcare provider will review the results with you. It is important to understand that screening for lung cancer is a process, not a single test, so achieving the greatest reduction in risk of dying from lung cancer requires adherence to recommendations for ongoing scans, typically at yearly intervals, and follow up on any abnormalities. So, what is cancer screening anyway? Cancer screening is looking for cancer before a person has any symptoms. Screening tests can help find cancer at an early stage before symptoms appear. When abnormal tissue or cancer is found early, it may be easier to treat or cure. By the time symptoms appear, the cancer may have grown and spread. This can make the cancer harder to treat or cure. It is important to remember that when your doctor suggests a screening test, it does not always mean he or she thinks you have cancer. Screening tests are done when you have no cancer symptoms. Thank you.